Remember how I said that there were tons of muscles at the hip and not too many at the knee? Here's where that comes in handy. This should be a short little segment. So we said that the knee does flexion extension and internal and external rotation, right? So that gives us only two categories of muscles that we need to address. There is a wonderful little chart in the Mansfield text on page 293 with the innervation of the muscles of the knee. And it's mostly the femoral nerve and the sciatic nerve with a few little spares for some other things. So we'll talk about that. So the learning objectives, of course, are to identify the prime movers of the major knee motions and their origin, insertion, action, and innervation, identifying relationships of muscles to each other using anatomical terms, and identifying the muscle credited with unlocking the knee or initiating knee flexion. So in the last section, we talked about the screw home mechanism a little bit, and the screw home mechanism takes advantage of osteological features of the knee to lock into that fully extended position. Well, then how do we unlock that? We have to use muscles. So the innervation of the knee muscles, the femoral nerve supplies the sole source of innervation to the quadriceps, which are the major knee extensors. So if you lose your femoral nerve, you're in trouble for knee extension. It severely hampers your mobility. So I've worked with lots of different people with femoral nerve injuries for all different reasons. Anything from a brain injury to a surgical, a post-surgical complication to a stab wound can injure your femoral nerve. And so I've worked with people that had all those things and more. And of course, that makes it very challenging to flex your hip and extend your knee, which interferes with walking to a great extent. The tibial portion of the sciatic nerve innervates the semitendinosus, semimembranosus, and the long head of the biceps femoris, which are primary knee flexors and rotators. The fibular portion of the sciatic nerve, also known as the peroneal portion, innervates the short head of the biceps femoris. The obturator nerve innervates most of the hip adductor muscles, and some of those act on the knee. Not to a great extent, but they do. So the knee muscles are mostly divided into extensors, which are the quadriceps, and flexor rotators, which are primarily the hamstrings and a few other little accessories. So even though each of these muscles has important individual actions, they work in teams to maximize movement control. So the example is standing from a seated position. It requires simultaneous activation of quadriceps and hamstrings. So quadriceps are knee extensor agonists, and so the antagonist is the hamstrings. But hip extension, hamstrings are the agonist. And so you have to activate them simultaneously in order to perform that very common, very important functional movement of standing up from a chair. So we talk about muscles in isolation sometimes in kinesiology, but the important thing to remember is they never work in isolation in the body. So our quadriceps are our main knee extensors. The term quadriceps is used to describe the group of 4 knee extensor muscles. So they include the rectus femoris, which we know is also a hip flexor, and then the vastus lateralis, vastus medialis, and vastus intermedius, which are only knee extensors. That's all they do. So the rectus femoris, as we talked about in the hip, its origin, its proximal attachment is the anterior inferior iliac spine, AIIS. Its distal attachment or insertion is the tibial tuberosity. All of the quadriceps attach their inferior attachment. Distal attachment is the same place through the same tendon. They share that common tendon. The rectus femoris does knee extension and hip flexion and is innervated by the femoral nerve. The vastus medialis, its proximal attachment is the medial lip of the linea aspera and the intertrochanteric line of the femur. So it's on the posterior side of the femur. And the distal attachment is the tibial tuberosity. So in order to get there from its origin to its insertion, it has to go around the corner. And if you look at the direction of the muscle fibers here, that's the vastus lateralis, that's the vastus medialis. They're wrapping around from the back of the femur to the front. So the vastus medialis is providing knee extension, but it's providing some medial tracking on the patella. The vastus lateralis is providing some lateral tracking on the patella. The two of them together, along with the vastus intermedius and the rectus femoris, provide that vertical force on the patella. But it's a combination of medial, lateral, and vertical forces. And so they have to be balanced in order for that to work properly, in order for the patella to track properly. So that's something to really think about, is that patellar tracking and the balance that has to happen. So if the vastus lateralis is stronger, you're going to get lateral tracking of the patella. If the vastus medialis is stronger, which is rare or extremely uncommon, you would get medial tracking of the patella. So in order for to decrease joint forces, you want to have good tracking of the patella in the patellar groove. And so if you have muscle imbalance, that is going to interfere with that. So the vastus lateralis attaches on the lateral lip of the linea aspera and the intertrochanteric line and gluteal tuberosity. So just think lateral lip of the linea aspera, and attaches through the tibial tuberosity, just like the other quadriceps. Vastus intermedius is probably the simplest. It only crosses one joint. It attaches on the upper 2/3 of the anterior femur, and same attachment as the other ones on the tibial tuberosity. And they both do knee extension. They're both innervated by the femoral nerve, just like all the other quadriceps. So the quadriceps have to do knee extension concentrically when you're doing everything. If you're coming down the stairs, they have to do knee extension eccentrically. And if you're standing, they have to do knee extension isometrically. So the quadriceps perform knee extension in lots of different ways, and it's all very functional. That having been said, we work on quadriceps a lot in PT. All muscles are important, but some are more important than others. The quadriceps are right up there at the top of the list, along with the gluteus medius. So the knee flexor rotators include the hamstrings, the semimembranosus and semitendinosus and biceps femoris, long and short heads. So we talked about the three of them in the hip. They all have their origin or their proximal attachment on the ischial tuberosity, and then their distal attachments are on various places on the tibia. They all span the posterior thigh, and they perform knee flexion. All of them except the short head of the biceps femoris also perform hip extension. They work very closely in teamwork with the quadriceps for functional activities. Most hamstrings cross the hip, and the hip position affects their operational length. So you could get into a position of active insufficiency if your hip is in extension and you're flexing your knee. There's only so far those actin and myosin filaments can cross over before they lose power. So active insufficiency of the hamstrings is a common occurrence with some activities depending on the position of the hip. So the gracilis and the sartorius are also knee flexor rotators. They provide stability to the medial aspect of the knee. They assist with flexion and internal rotation of the knee. So they both attach proximally to the pelvis, and distally they course posterior to the medial lateral axis of rotation of the knee, and that's what gives them the line of pull for knee flexion. The tendons of the gracilis, the sartorius, and the semitendinosus join for their collective insertion at the pes anserinus, at the anteromedial aspect of the proximal tibia. This picture is a cadaver picture, and the reason I picked it is because it shows very well the tendons of the gracilis, the sartorius, and the semitendinosus. So gracilis is the one that is most anterior, followed by the sartorius and the semitendinosus. I also like this picture because it reminds me of the aliens from Star Trek Insurrection, where they're trying to mine the planet's atmosphere for the Fountain of Youth. But okay, that doesn't have anything to do with the knee. But anyhow, because of their line of pull, the gracilis and sartorius, besides knee flexion, they can also perform that internal rotation of the tibia on the femur. Okay, so keep that in mind. So the gastroc and the plantaris are also knee flexors. They cross at the ankle and they have strong lines of pull for ankle plantar flexion, but they also cross the knee, so they have a line of pull for knee flexion because they run posterior to the medial lateral axis. The gastroc is a powerful two-headed muscle. It produces large plantar flexion torques across the ankle. The plantaris is dinky. It says relatively small. So I said, why use the plantaris when you have this giant gastroc to do the job for you? But we could call the plantaris the gastroc's little helper. It's probably not doing that much, but it has the same line of pull and potential action as the gastroc. So the popliteus, its proximal attachment is lateral. It's the posterior lateral aspect of the femoral condyle. Its distal attachment is the posterior surface of the proximal tibia. So it runs lateral to medial. So that lateral to medial, that should clue you in that it has some rotational abilities. It's innervated by the tibial nerve, tibial portion of the sciatic nerve. It initiates knee flexion, and it performs knee internal rotation. And so we're talking about internal rotation of the tibia on the femur to unlock the knee. So if you recall the video showing the screw home mechanism, in open chain, the tibia moves laterally, rotates laterally on the femur. To unlock the knee, you have to rotate it medially. So the popliteus has that line of pull for that medial rotation to unlock that knee flexion. Okay, so the popliteus is the muscle that is credited with initiating knee flexion. Some people call it the popliteus. I don't call it that. I call it the popliteus. I don't care how you pronounce it, as long as you know how to spell it and you know what it does. It doesn't matter how you pronounce it.